Hello, my name is Patty Olinger, and I am the Executive Director of GBAC, the Global Biorisk Advisory Council, which is a division of ISSA. And regretfully, I am not able to be with you today in person, but we'll make up for that in May when I come to the ISSA Pillari show in Milan. So today I want to talk to you about the UN Sustainable Development Goals, how it actually applies to environmental health and safety, as well as how we clean for health, and really a public health preparedness response. So GBAC's fundamental principles, as I have here, our passion is to work with organizations, individuals, governments, to help them be prepared for infectious disease outbreaks. This last year has been very busy, and we've worked with individuals all across the world, helping them prepare to reopen, to have confidence, and to put safety measures in place for their employees, for their customers, for their communities. Now, our GBAC ambassadors, we have an ambassador board, and interestingly, as I indicated, we are a part of ISSA, which is one of those things, as you already know, has a wealth of information and a wealth of technical expertise. Our ambassador board is made up of experts in scientific disciplines with scientific experiences with groups like WHO, with World Health Organization, with the Center for Disease Control, for the Canadian equivalent of the Center for Disease Control in the USDA. Myself, I'm an ISO convener for the development of international standards on biorisk management. And I have worked with the European Union on developing the SEN workshop agreements with regard to biorisk management. We have hundreds of years of experience, not just in science, but we've also have ambassadors that have different disciplines for industries, and also those influencers that are out there in different disciplines like hospitality or travel or, you name it. What we have found, which has been just so fulfilling to be able to work with these organizations, is that there's not a discipline out there that was not affected by this pandemic that we are hopefully coming out of, and everybody needs help. So in 2019, when I joined ISSA, moving from an academic leadership role in environmental health and safety at Emory University in Atlanta, Georgia, where if any of you are familiar with Emory and where it's located, we literally surround the U.S. Center for Disease Control, and we provide that medical support to them. I provided support not only into the academic institution, but also into the healthcare institution. And when I joined ISSA, John Barrett actually convinced me to leave Emory to join ISSA to help change the world views cleaning and to look at what we can do to develop what we called a sustainable and a scalable response to infectious disease outbreaks and pandemic, looking through the lens of cleaning and sanitation. Jeff Cross asked me to write an article, and the article was written in the fall of 2019. It was published at the beginning of 2020, and the underlying theme was, we will have a pandemic and we're not prepared. Now, I didn't have a crystal ball, but what we did and what we looked at was that whole aspect from a cleaning and sanitation standpoint. If we looked at what had happened over the years, we knew we weren't prepared, and we knew that we needed to do better. So SARS-CoV-2 really has shifted our thoughts. We've looked at air, at water, at surfaces, and what are the best practices that we can put in place to really limit the impact of outbreaks and pandemics. We definitely need to be moving from pretty and smelling nice to a scalable response, and we really need to rethink how we're cleaning. We also have to start looking at aspects of other things that we're doing. So our environmental impact of what we do on a day-to-day basis is extremely important. And we know that climate change alone, when we just look at climate change, has a significant impact on health and wellness. And it has a significant impact on the emergence of new infectious diseases, or the transmissibility, you might say, on things that we already know: measles, monkeypox. And we're starting to see more and more infectious diseases start to move. And as our populations and the ability to move is also increasing over the years, we realize that, climate change alone, as one piece of the puzzle, has an impact. As I just indicated, and as I kind of referred to, we're starting to see more infectious diseases that are starting to, affecting our lives on a day-to-day basis. And this isn't even complete. I mean, we could go back for hundreds and thousands of years looking at, bubonic plague, and all the way up, and monkeypox isn't on this, of what we've seen. Since 2014, we've seen more and more Ebola outbreaks in sub-Saharan Africa. And it's one of those things that we really do need to start paying attention and putting in place resilient programs and a scalable response. So how do we start moving forward from all this? I've been involved with Global Health Security Agenda since its beginning in 2014. I've also been involved with international health regulations from a standpoint of looking at how it impacts public health. And when we start looking at these global initiatives, what we're seeing also with our UN Sustainable Development Goals and our ESG, our environmental, our social, and our governance, we really need to start working together, start focusing on our passion, but realizing how we impact, and we need to do better. On July 28th, 2022, this to me is so significant, especially to the cleaning industry. The UN General Assembly declared that access to clean and healthy environments was a universal human right. That is significance. And we in the cleaning industry have so much responsibility to help with this initiative. How this will then be incorporated into our international health regulations, our UN SDGs, it definitely supports it. We need to watch and be part of that initiative. So many of you may already know, but what John had asked me in the very beginning, knowing my background in quality management systems, he understood that we have, that we need to help people open up. So we started the GBAC Star accreditation program, a quality management program, back in May of 2020. We now are in over 85 countries and multiple disciplines, as well as multiple languages. What we found in this last year is that many of our facilities worldwide are using their GBAC Star accreditation to show how they are supporting the UN Sustainable Development Goals in their ESG measures and metrics. To me, this is something that, coming from my biosafety, my biosecurity background, there's a concept that we've called One Health, that we need to take care of our environment, our humans, our animals, and our plants, and keep them healthy. And when we look at that, it's a One Health perspective. And realistically, this is what we're doing now. We are looking at how we keep the human population healthy, the animal population healthy, our plants healthy, and our environment. It has such an impact on human beings and our earth. So I'm sure many of you are very familiar with the UN Sustainable Development Goals. There are 17 what I call action packages. And a lot of people, when they hear that word sustainability, they immediately go to the green aspect of things, looking at recycling and environmental impact. But I want to highlight a couple of them in a minute, because to me, I love this next slide where they show that they are so interconnected. If I keep people healthy and I keep them at work, their work is to stay open. They're able to earn a paycheck. They're able to go to a store to buy groceries, to buy food. They're then able, to reduce poverty. So these different action packages are extremely connected. You can lump them underneath ESG, and you'll find that some of the action packages are actually in more than just environment or social or governance. If you look at, to me, when you look at labor impact, I'm going to talk a little bit about training. And accidents and injuries. These statistics are from the International Labor Organization. 2.3 million workers die every year from work-related injuries and accidents. An additional 160 million are estimated of workers suffer from non-fatal work diseases, and another 313 million from non-fatal injuries per year. When we look at these things, it's very interesting to me because it's like we all know that there are many that are not going to be reported. And how this is going to impact from an environmental health and safety standpoint, and the impact that we have from COVID-19 and our infectious diseases aspect it will be interesting to watch these statistics from this last few years. The important thing is to realize that if we're starting to do better, these action packages within the UN SDGs are being impacted. We also can look at education. To me, training is a core component to our workforce. And if we can train people from a cleaning standpoint to clean for health, if we can train people also through our partnerships, again, looking at a couple of those UN Sustainability Development Goal action packages, we can do better. What we have tried to do is take the Sustainable Development Goals and look at our STAR accreditation and see where our STAR facilities can be impacted. I think the most important thing to think about when we start looking at the UN Sustainable Development Goals is find your passion. It is not I'm going to win on my action packages and you're going to lose. We need to show how they're interconnected, and we need to start working through the partnerships and through affiliations. It is so extremely important. So again, I believe we need to start looking at a One Health philosophy. It's the air we breathe, the surfaces that we touch, and the water we drink. There's a couple of resources that I want to make sure that Tony gets available, but I put the links in here. These are, this is a free resource from our STAR report. Please feel free. Again, we also have an awareness course that is in 6 languages that you may be interested in, and we just launched here at the ISSA show in North America, the Trusted Advisor program. So I'd like to thank Tony for this opportunity, and again, I regret that I'm not able to be there with you in person, and I look forward to meeting you in May. Thank you.